Community Voice Short.
Welcome to the Community Voice. I'm your host, Katie Roche. Today's show is just one part in a series of conversations with community members concerning the November 6th vote on the 21 ordinance. The debate over the age that bar patrons may be allowed in Iowa City bars is not a new issue to Iowa City, but what is significant this time around is that voters will decide whether the 21 ordinance will be passed into law. Meaning that if the 21 ordinance is passed into effect, patrons of bars in Iowa City will have to be 21 years old in order to be in a bar after 10 p.m. or face a $250 ticket. Right now, Iowa City has a 19 ordinance in effect stating that 19 and 20-year-olds must vacate bars by 10 p.m. or face that $250 ticket. In this Community Voice series, we will hear from Community Voice viewers like you who are both opposed to and in favor of adopting this mandate. Stay tuned to City Channel 4 to learn more about this important issue, and remember to vote on November 6th.
Dance all night with a bottle in your hand. Come on and give fiddler a dram, fiddler a dram, fiddler a dram.
I'm wondering if you could just comment on the term binge drinking and how it relates to this issue, because some opponents to the 21 ordinance have said that they actually don't believe in the term binge drinking, that some of the research that's been used to establish that term, it could easily be swayed in one direction by 15 minutes or by the size and the weight of the person being studied. And so I'm curious if you could just address that.
Science uses various measurements to determine or assess or describe events and activities, and so there had to be some agreement reached to determine what that measurement would be. No one purports that the measurement that's used is the best perfect measurement, but it is an agreed upon measurement among researchers that 5 drinks for a male in one evening or at one time, or 4 drinks for a female, is classified as binge drinking. It is accurate to say that that measurement is disagreed upon by some people, but researchers generally that work in this area agree that it is an appropriate measurement.
The person who binge drinks is harming themselves. They are doing damage to their physical person. But they also do damage to me when they break the window on my store, or when they vomit on the sidewalk and you have to walk around it and somebody else has to come clean it up, when they go back to the dormitory and make a lot of racket and wake up their roommate who has to babysit them all night long. Those are all secondhand effects. People that are assaulted, almost always, either the victim or the perpetrator or both have alcohol problems. And by curbing or reducing binge drinking, the research shows that those second-hand effects will go down. And they've gone down at the University of Iowa. Our binge drinking rate has stayed at 69% for years. But the rate of assaults and waking up somebody, interrupting study, unwanted sexual advances, those things have all diminished over time, as tracked by the Harvard School of Public Health and the college alcohol survey that they did on our campus.
First of all, the definition of binge drinking was created by Dr. Weschler from the Harvard School of Public Health, and in his original data, if he'd changed his time by 1 hour or the number of drinks by 1 drink, instead of in the original data 62% being binge drinkers, it would have been 6% being binge drinkers. The data was manipulated to create a problem. There are a number of people who've been researching student drinking patterns much longer than Dr. Weschler, but they don't get the attention he and his studies do because they're not funded by the Robert Wood Johnson Foundation, which has put hundreds of thousands of dollars into these efforts on college campuses to change drinking and change student behaviors. And some of the research has been manipulated to achieve a goal. And there has been a huge amount of money that has come in from out of Iowa City to do this. I mean, a huge amount of money to the Stepping Up Project, to manipulate public opinion. I mean, a lot of dollars have come in nationally into Iowa City to try and manipulate this and manipulate public opinion.
The Harvard School of Public Health, Henry Wexler, began surveying universities and colleges more than a decade ago. And he established the binge drinking definition based on the number of drinks for men and women over a certain period of time. It's been researched a number of times and established as a pretty reliable statistic. And so it's really not an arguable thing. People may have different views about it, but the amount of alcohol consumed over a certain period of time, 4 or 5, whatever it is for men and women, does produce intoxication. And so that's the basic definition of binge drinking that has been used to create surveys and make a determination about the level of abusive drinking that occurs in communities among college students.
Well, see, what happened, I think, is that these big outside players sold this idea on the basis that it would reduce drinking, but really what they wanted to do was see if it would. So what we have is a difference, a difference of, agendas, really. I mean, our local temperance people have they really believe in this. They really believe that without the 21 ordinance, we're never going to see a reduction. But they've been saying that all this stuff is going to work for 10 years. And I started looking I started looking for the research, that would support this, because they've been saying, well, it's just a settled matter scientifically, So, well, they wouldn't say this if it wasn't true, so there must be some research about, 21 ordinance. There isn't any. In fact, I think that's what this is all about, is just to see what happens. It's really a big experiment, and they're using us as lab rats, and I'm kind of tired of it.
So you believe that the 21 ordinance would help to decrease the opportunities for underage drinking and harmful drinking, such as binge drinking?
It would help, it wouldn't solve. And it actually is not so much that it decreases the alcohol use. It increases the opportunity to do non-alcoholic activities. So you learn that you can have fun, you can flirt, you can have a good time, you can listen to music. And it doesn't necessarily have to be organized around alcohol.
Do you believe that the 21 ordinance would help to curb binge drinking?
Yes, it will, because again, we know through evidence, and I am a scientist, I do look at that, is that you decrease access and you decrease use. And that's binge drinking is right now the most important marker of that we have. So yes, I know that to be true.
When I was a freshman in college, I probably did a little binge drinking now and again. And I'm still here, and I happen to get 3 degrees, and I'm okay. And I think they're all a little just anal, to use a word, about this whole problem.
The reason I'm concerned about excessive and underage alcohol consumption in Iowa City is because the county health department has done a community health needs assessment at 5-year intervals for the last 10 years. And in each one of those assessments, excessive alcohol use and underage alcohol use has been identified by community members as being one of the top 5 concerns. So as the director of the county health department, I feel a great responsibility to assure that the county health department is involved in addressing this issue.
And you believe that the 21 ordinance would help to create circumstances in which there would be less alcohol consumption for minors?
Creating an environment that reduces access and availability to alcohol has been demonstrated through research to be an effective strategy to reduce the excessive consumption of alcohol across the board, but particularly among those who are underage.
The segment that you just watched is just one in a series of conversations with community members concerning the November 6th vote on the 21 ordinance. Stay tuned to City Channel 4 for other perspectives and more information on this issue from Community Voice viewers like you.
Dance all night with a bottle in your hand. Come on and get fiddler dram, fiddler dram.